Florida is a giant factor, but hardly alone in pushing this coronavirus case count to the new records and pushing our national tracking map deeper into the red. Let's take a look, and let's begin just with the new record yesterday in the case count. If you bring it up, 40,000 cases. If you go back through March 16th, that's when the White House announced the initial slow the spread measures. You see in April, South Carolina was among the first to start to reopen. April 24th, way back April 24th was the previous one-day high in cases. Then you see, and we knew this was inevitable. As the reopenings happened, we knew it was inevitable the case count would go up. The question is, this much, this far out, and is it manageable? But you look at that now, a new single-day record here in January. So this is a month ago. Look at this picture 1 month ago. Look at the green on this map. Green is going down. It included Texas. Florida was stable at the time, right? A month ago, 20 states going down, 13 steady, 17 states going up. That's the orange. Remember this map. This is a month ago. This is where we are now. Look at all that orange and all that red. You have 32 states heading up in the wrong direction, 11 holding steady, only 7 states now going down. Now, we knew the case count would go up. The question is, in these deep red states, you see Florida, you see Texas, you see a lot of the West, you see Michigan, 50% higher cases this week than last week. We knew the reopening would bring up cases. Would it go like this? Well, one of the reasons you see this, 8 states just this week have paused the reopening, including giant Texas, in Arizona, because the governors are seeing the data that they don't like. 8 states pausing the reopening because of this state trend map. 32 states now heading up. Let's bring in Dr. Amesh Adalja from the Johns Hopkins Center for Health Security to share his expertise and insights with us. Doctor, we knew the case count would go up as America reopened. That was inevitable. But the pace of this, when you see so many states going up so dramatically, several governors deciding they have to hit the pause, is this what we anticipated, or is this worse?
This is worse than we anticipated. Many of us thought that with this economic shutdown being lifted, with stay-at-home orders being lifted, that states would have put in place contact tracing teams that would be able to deal with the number of cases that we would get so that they wouldn't spiral out of control, that we wouldn't get rising percent positivity rates on tests. And it seems to be the case that many states did not take that time to have adequate contact tracing, because this is how you can manage the number of cases that you're going to get. And it doesn't seem that we're in that place in many states in the country.
And so you have Dr. Fauci and Dr. Birx today talking about abandoning the way we are currently testing and going to something called pool testing. Explain to our viewers what pool testing is and whether you believe it would be helpful.
So pool testing is when, instead of taking an individual a nasal sample from somebody, you take a whole bunch of them and you put them together and you run a test on that whole batch. And then if it's negative, all those people are clear. But if it's positive, then you go back and individually test those samples to see who was positive. And this might be a way to increase the throughput, be able to test more people and help communities understand how much prevalence they have of this virus in their populations. And this is a way to maybe improve the way we do testing now, which is very individual based, and we're still undercounting, we're still missing, because not everybody is coming for a test, and there are still some logistical difficulties with getting a test. So we've done this, for example, with HIV before, and I think it is something that we need to try, because clearly what we're doing now is not working in many states.
Well, if it's been done before and it's proven to be effective, and we knew that testing was an issue way back at the beginning months ago, why wasn't this done months ago? Why are they just deciding now?
This is a great question. This was something that people had debated. Should we move to pooled testing? And there were individuals thinking about it for congregate settings, maybe jails, for sports teams, for people that were traveling together, that might have been one way to do it. But it is something we probably should have considered earlier, because we still have issues with capturing all these cases, or we wouldn't be having the type of spread we're seeing in Texas and Arizona and Florida. So I do think we need to really rethink how we approach this virus in the future.
I don't like dragging the doctors into the politics, but I think at times it is vital, because a lot of people listen to the President of the United States. A lot of them follow his lead. When you hear him, as he said last night, you know, we're doing all this testing, and they come up with somebody's got the sniffles, and they call it coronavirus, essentially being dismissive of testing. And essentially, he's been saying in recent weeks, we're doing too much testing. And that's why that number on the screen is going up, not because we're not doing enough to control the spread of the virus. What goes through your mind when you hear that? What signals does that send to people?
this is just widespread evasion from the highest levels of government, and that's been characteristic the entire time of this pandemic. That we need to do testing, we need to do as much testing as possible. That it isn't something that we should be looking at as a scoreboard. And the fact is, maybe some people do get the sniffles from it, but they can then transmit that infection, and that's what's happening. Is younger people are getting infected now, going to bars and then transmitting it to individuals that are needing hospitalization. So this isn't something that, even though it might just cause the sniffles, can be kind of laughed off or evaded. And I think the fact is, this pandemic, when you look at the administration's response, has really been disappointing on all levels. And it didn't have to be this way. We squandered time in January, February, and March when we could have done what countries like Taiwan did, but we didn't. And now we're faced with this pandemic that is going to be out of control again if we don't take action quickly.
And so next hour, we'll get the first public briefing by the Coronavirus Task Force of the White House in 2 months. So they finally got the message that they need to do something. They need to show the public that they're trying to get back on top of this. Dr. Fauci saying this in the Washington Post today: something's not working. I mean, you can do all the diagramming you want, but something is not working. What you need to do is find the penetration of infected people in your society, and the only way you know that is by casting a broad net. What, sir, in your view, is not working, and what can this task force do today to make it better?
What isn't working is the fact that we're letting cases go by. They're not being diagnosed. That's the only way we would get this rising percent positivity, meaning that this virus is spreading faster than our testing, and that there are cases that are going undetected and starting chains of transmission that are landing people in the hospital. So what we need to do is understand who is infected. We're still having that basic problem of understanding who is infected in the community and who isn't. And those people that are infected need to not be associated with other people for a period of time, because that's what's happening. We're not breaking the chain of transmission. So we have to try things differently in order to stop this, because the virus isn't going anywhere until there's a vaccine, and we can't have this open and shut, keep doing that. That's going to be very disruptive to businesses and to the economy. We have to get this right, and I think many states did get it right, but I think that clearly not all of them did, and I think we have to rethink this whole approach in those states.
Dr. Adalja, grateful for your insights and expertise today, and as always, thank you, sir, very much.
Thank you.